Are you saying that the COVID vaccines actually don't work? Or maybe you're saying that the COVID vaccines don't work against the Delta variant? I mean, what are you trying to say? You know, this is a question you guys have asked me a lot since the CDC came out saying that those who are vaccinated, who live in areas of high or substantial COVID transmission, actually need to start wearing masks indoors. We also know the CDC says we need to start wearing masks in schools again. And many of you have said, well, okay, so what are they actually saying? Are they saying that this vaccine doesn't work like we thought it did, like they've been saying it did? Is that the deal? And by the way, as a little reminder, I should say that unvaccinated people are supposed to have always been wearing masks, just as a reminder. I'm Dr. Jen, practicing family physician, on-air health expert, video creator. Let's start with the vaccines. If you get the COVID vaccine, you are far less likely to get really sick from COVID, to be hospitalized due to COVID, or to die from COVID than people who are unvaccinated. That's what these vaccines were meant to do, and that's actually what they do. This vaccine is a layer of protection. I am vaccinated. My parents are vaccinated. I'm asking my patients to get vaccinated. You are hopefully vaccinated. Those who are vaccinated, it's almost like we have another layer of protection. It's almost like a raincoat that we have on when we're walking out on a rainy day. Because with this layer of protection, if we were then to get COVID, okay, we would probably only have very mild illness. And we would be less likely to be hospitalized and less likely to die than someone who doesn't have that raincoat on, those who are unvaccinated. So when you ask me and you say, well, Dr. Jen, well, why am I having to wear a mask then? Tell me this vaccine doesn't work? No. That's not what we're saying. And that's not what the CDC was saying. As a matter of fact, these vaccines are working like we thought they would. They are protecting those of us who are vaccinated from getting severe illness, from being hospitalized or dying if we were to get COVID. You know how we keep saying that the majority of the people in the hospitals right now and the majority of the people dying from COVID are those who are unvaccinated? We say that because the unvaccinated people don't have that layer of protection like those who are vaccinated do. If you're vaccinated, you have an extra shield, a force field, a shield around you that if COVID were to come into your life and to infect you, you might get the sniffles, you might sneeze, you might get a headache, but you're less likely to die from it. You're less likely to be hospitalized and be put on a ventilator than someone who doesn't have that shield of protection. So the CDC asking vaccinated people to mask up indoors is not about the vaccine not working. Oh, and by the way, the vaccines do work against the Delta variant. Okay, they do. So I know you're saying, all right, okay, so you're saying this is not about the vaccine not working. Well, then what is this about? Okay, well, let me tell you. The reason why the CDC had to come back and tell us vaccinated folks to start masking up indoors. And by the way, I mean, I'm happy that we're following the science, but man, am I disappointed. I didn't want to go back to wearing masks just like I know you didn't. None of us wants to do this. It is disappointing. It feels like we're going backwards. But what's most important is that we're doing the safe thing, and that's what the CDC is doing, and that's what we will all do. But the reasons why vaccinated people have to start wearing masks are, well, in no particular order. Number one, COVID cases are increasing. You see this on the news. Number two, Delta variant is a game changer. And the Delta variant is not functioning like prior versions of this virus have functioned in the past. Number three, a lot of this country, the US, is not vaccinated. I still don't know why, but we're not. And by the way, the more people that are unvaccinated for longer allows the cases to rise and allows for potential other variants to come up, etc. Just by the way. In addition, even though, and maybe we're on number four is that, you know what, in May or so, when the CDC said that, hey, if you're vaccinated, you're good to go, you don't need to wear a mask. Well, you know what? In my heart of hearts, I don't believe it was only those who were vaccinated ditching the masks. I would still go into places, and I see nobody wearing a mask, and I have a hard time believing that everyone in the locations I'm at are entirely vaccinated. My belief is, and many people's belief, is that there's a lot of people unvaccinated that have not been wearing masks, which has allowed COVID to spread further. And then number five, which is probably the newest reason that the CDC gave during their press conference, telling us, the vaccinated people, we had to start wearing masks again, is that now we are learning that people who are vaccinated and people who are unvaccinated can have the same amount of viral load in their system if they are to become infected with COVID. Let me just sort of distill this down a little bit. we used to think, or at least with prior versions of COVID, we felt that if somebody who had the vaccine were to contract COVID, the amount of virus in their system would probably be a lot smaller than someone who didn't have the vaccine, and that person would be less likely to spread it to someone else. Well, what we're finding out now, whether it's due to Delta or other circumstances, is that people who are vaccinated, if you get COVID, we can actually have the same amount of virus in our system as people who are unvaccinated, which means that we are more likely to spread COVID to other people who may be unvaccinated or children who cannot get vaccinated, etc. Now, once again, it doesn't mean that the vaccine is not effective for us, because remember, we're vaccinated, we got the raincoat on. So the likelihood is, even though we have more viral load in our system, those of us who are vaccinated, the likelihood is we're not going to get very sick from it. We're not going to be hospitalized very likely. We're not going to be intubated very likely. We're not going to die very likely, but we are more likely to spread it to others than we initially thought. Now, this is data that's still yet to come out. It should be coming out very, very soon, but that is the rationale that the CDC gives for why we have to start masking up those of us who are vaccinated while we're indoors, especially in places with high or substantial transmission. I'm going to say this again. I want to remind you that those who are unvaccinated are always supposed to have been masking up, just as a reminder. So remember, these vaccines do work. Remember, the people who are dying from COVID, hospitalized from COVID, are not those who are vaccinated. That's what tells us the vaccine's working. It means that our raincoat, our force field, our layer of protection is protecting us from dying mostly, from getting really sick mostly and being in the hospital, et cetera, et cetera. But we're finding out, however, that we still may be able to spread it on to those who are unvaccinated or who can't get vaccinated. And that may very well be contributing to some of the transmission in this country. Although the CDC says that it's not a major part of transmission, still the main issue is people who are unvaccinated and those not wearing masks, et cetera, et cetera. I hope this is helpful. I know this was a little bit longer of a video, but you guys have been asking about this. Let me know what you think. Let me know what your thoughts are. Ask your questions in the comments. Of course, I read them. It's how I determine what I talk about, because I want to answer your questions. I think the biggest message here is to go get vaccinated if you haven't, right? Even more reason to go get vaccinated. And guys, remember, the masks are not going to be forever. What we have to do is get everyone vaccinated and get the kids vaccinated once we can, so that we can move forward in our lives. I'm Dr. Jen Caudle. If you're interested in joining my group called I Got the COVID Vaccine, that's a group that you can ask questions. You can hear from other people who are getting the vaccine, who've gotten it. Guys, I'm Dr. Jen. I'll see you soon.